The British Journal of Neurosciences Nursing 2014 states that if all appropriate high-risk atrial fibrillation patients received early treatment, it is estimated that more than 3,000 strokes annually could be prevented. I'd like an opportunity to prove that research shows that the use of anticoagulants or blood thinners in atrial fibrillation will help reduce the occurrence of stroke because it helps prevent blood from clotting, and luckily there are several options of anticoagulants. First, I'd like to talk about exactly what is atrial fibrillation. Then I'd like to describe how blood clots form due to AFib. Then I'd like to follow up with the different types of anticoagulants, their pros and their cons, and then with the discussion of not being atrial fibrillation. To start, let's look at what is AFib. The Mayo Clinic in 2002 described atrial fibrillation as an irregular and oftentimes rapid heart rate that commonly causes poor blood flow to the body. A heart in atrial fibrillation cannot contract strongly enough to completely empty the blood in the atria with each beat. During AFib, the heart beats so chaotically that it cannot beat in synchrony with the lower two chambers of the heart, the ventricles, and in such a condition, the blood flow to the rest of the body is so affected that people will often complain of shortness of breath, fatigue, lethargy, palpitations, sometimes even chest pain. Paroxysmal AFib is when the AFib comes and goes without rhyme or reason. You'll be in it for a couple hours and without it for days or weeks, and it comes back. Over time, it will progress into a more permanent condition, and this is where you'll generally have a patient come in, with the aforementioned symptoms. As a rule, AFib generally originates in the pulmonary veins that feed into the back of the left atria. This is the backside of the heart. These are the atria, or right here, and these are the pulmonary veins that feed into the left atria. This is inside the left atria. You can see those 4 red circles. Those are where the pulmonary veins are feeding into the left atria. And that's generally where the AFib begins, is from these pulmonary veins. For some reason, there's a lot of electrical activity in there, and it transfers into the atria, and it causes the atria to, hardly squeeze, so the blood flow is very poor. According to the British Journal of Healthcare Management 2015, people in atrial fibrillation have 5 times better chance than those of us in normal sinus rhythm of having a stroke. And in the British Journal of Neurosciences Nursing 2014, it went on to say that 1 out of every 5 patients that are people that are found to have had a stroke were actually in atrial fibrillation. The atria, as it's fibrillating, because the blood flow is so poor, blood will start to pool and it will start to clot. And over time, these blood clots are pumped out into the body's blood circulation, and that can lead to stroke. Those statistics are staggering and quite frankly frightening. Luckily, we have a solution that can dramatically decrease the risk of a possible life-changing event. And that line of drugs is called anticoagulants, or are more commonly known as blood thinners. There have been blood thinners around for 50 years. In 1948, warfarin or Coumadin was introduced initially as a pesticide for rats and mice, if you can imagine. And in the early 1950s, it was found to prevent thrombosis in humans, and was so introduced in 1954 for medical use, according to a practical guide to anticoagulation 2013. And warfarin is by far the most widely used of the blood thinners. I suspect that's because of the many years of its use, the familiarity of both layman and doctor alike, and because of its longevity, the price of this particular med is dramatically less than some of the other anticoagulants, such as Pradaxa or Eliquis. A drawback to the blood thinner Coumadin is that it has a very narrow therapeutic window, and that's why those who are taking Coumadin have to have their blood drawn 2 to 3 times a week to check the international normalized ratio, or INR, to see if the blood is too thick or too thin. If it's too thick, the drug is ineffective as an anticoagulant, and you run the risk of clot or a stroke. If your blood is too thin, you run the risk of internal bleeding or bleeding into the brain. The great thing about Coumadin, aside from the price, which is a great plus, is its ability to be reversed if the blood is too thin, and they do this with vitamin K generally, by IV. Another anticoagulant we had, like I mentioned earlier, is Pradaxa. This was introduced in 2012. Pradaxa is a direct thrombin inhibitor, which means it directly inhibits the thrombin formation in the coagulation cascade, and that's just a nice way to say it inhibits the thrombin production the body normally does help coagulate the blood. What's nice about Pradaxa is there's no blood draws 2 to 3 times a week, which is really nice. It's a real time saver, but the drawback is it's so expensive because it's pretty new to the market, and we can't, have the generics made for, make it a lot cheaper. Another drawback to Pradaxa is those with diabetes or prior history of stroke or over 75. They can't take this drug. They have to take Coumadin until 2013, when Eliquis was brought to the market, and it's available to those with all those above mentioned diagnoses. But drawback again is it's expensive. It's a newer drug, but you don't have to have your blood drawn every 2 to 3 weeks. I hope by now you can see how just important being on an anticoagulant is for those in atrial fibrillation. The risk of stroke is just not worth it. Strokes affect more than just the person who strokes. They affect their family members, friends, co-workers, and with the several choices of anticoagulants available, from the old tried and true to the cutting-edge prescriptions, you do have a choice. But the first crucial step is just to make that choice. If you're currently in AFib or have been on AFib, or even have a family member on AFib, educate yourself. Share the message. Don't wait until the stroke has happened to you or a loved one. If you don't have access to the internet, talk to your family physician about it. It's so important. Just a little investment now can really pay big dividends in your future in terms of quality of life with family and loved ones. I thank you for your time, and we'll see you poolside.